let's talk heart health. So heart health is the #1 cause of death in the United States, cardiovascular disease. It's the biggest problem we're seeing, and the problems keep getting worse and worse with obesity rates going up. Our diets are getting worse and worse. We're really starting to see all these problems really take over. Now, what are the symptoms of cardiovascular disease? Biggest one is going to be high blood pressure. That's a huge one. Another one you're going to see is angina, or that's when it gets more severe. And that's when you're going to get pain with exertion, going up the stairs, walking a far distance, that type of thing. Another thing is going to be shortness of breath. That's because we're not circulating oxygen well to our lungs, into our tissues. You know, on some people, especially men, you might even start to see in the later stages, you'll start to see the hair on the feet and on the lower legs start to recede up the leg. Some people just think that's from socks and whatnot, but that's blood flow to those tissues is decreasing and that's starting to die. So those are some of the symptoms that we'll see. Now, what causes heart disease? Surprisingly, it's not cholesterol. That is not the biggest problem. It is inflammation, inflammation, inflammation. And you couple that inflammation with high blood pressure. High blood pressure damages the blood vessel walls. That inflammation comes in and it uses the cholesterol to try to heal it. When you start to heal that, then it calcifies, then you get these blockages. That's what leads to heart attacks and those issues like the blood flow issues to the lower leg, where hair might disappear from the toes, feet, lower legs. Obesity is a huge one. It causes a lot of inflammation in the body. High blood sugar, which commonly goes along with obesity, and high insulin levels. That's from eating refined carbs, a lot of sugar in our diets, drinking sugars, all that type of stuff causes that blood pressure to go up and all that inflammation, therefore damaging the blood vessels and therefore the heart. Now, what can we do about it? Sleep, stress, sugar. You need to be getting your good sleep. As the sleep goes down, our insulin levels go up, our blood sugar goes up. All those things we just talked about cause inflammation. Really should be shooting for that 7.5 to 8, maybe even a little bit more depending on your body and your REM cycle. It really just depends. Making sure we keep our weight down, not being obese. Exercising is a huge one. This helps with lowering our blood sugar and decreasing inflammation in our body. It doesn't have to be a lot of exercise. It can be walking an average of 10 to 15 minutes a day. It doesn't have to be all in one day, just an average. Decreasing our sugar intake, enormous. That's going to lower it. And you really need to look for those hidden sugars in your diet, in your drinks, in your yogurts, your peanut butters, all this stuff. Find the alternatives that do not have the added sugar. Obviously, I think we all know vegetables is another huge one. Those start to provide the nutrients that we need to the heart and our blood vessels to help keep that down. Making sure we do something for our stress relief, whether that is a hobby, exercise, reading, something that brings our stress levels down is critical. Let's talk about how we can evaluate for heart disease or preventatively. Big ones are getting some lab work, and that's not your typical lab work that your primary care physician is running and telling you need a cholesterol medication. Those tests are outdated, they're ancient, they're 40, 50 plus years old. Your LDL cholesterol and your total cholesterol are a terrible indicator of your cardiovascular risk. If you want to look at some old lab work, biggest thing you can do is look at your triglycerides and your HDL ratio. You take your triglycerides, you divide it by your HDL. As long as you're under 2.5 to 1, that gives you your cardiac risk ratio. You want to be under that 2.5 triglycerides to HDL. So that means if you have a triglycerides of 150 and your HDL is 50, then you're going to be at a 3 to 1, and that's going to be bad. We're going to be looking at like maybe triglycerides of 100 and HDL of a 50. So that's going to give us a 2 to 1. That's giving you an idea of where you want to be. Also, you can look at those triglycerides on your old lab work, and if those are super high, that's telling us we're eating too much sugar. That's how your body kind of transmits it. Another thing that you can do with lab work, big one is going to be your apolipoB. That's a newer test. There's an NMR test. It gives you the particle size as well as an insulin score of do you have insulin resistance? And we talked about how that plays into the heart health. Another one is your fasting insulin and your blood glucose. When you do all that, you can get blood sugar IQ score, and that kind of gives you an idea of your insulin resistance. And that insulin resistance really drives heart disease. Type 2 diabetes is insulin resistance. The biggest side effect of type 2 diabetes is cardiovascular disease. That's why that plays into each other. Those are some of the big ones that you can get. They're really not that expensive, especially if you go through an independent lab. Obviously, you can also look, BMI is not a great one, but it gives you an idea, are you overweight or not? Another good one to know if you have metabolic syndrome or insulin resistance is going to be to see, if you go stand up against the wall, does your belly touch the wall first? That's for men or women. If your belly's touching the wall first, then you're going to have some insulin resistance and something to start working on. Another test that we love to do, it's called an HSR, heart sound recording. We use it here in the office. It's basically a super stethoscope. It listens to the different valves of the heart. So we put it on the chest in 4 different places. We listen to the heart, it graphs it. It looks really similar to an EKG. So an EKG measures the electrical signal. We're listening to the sounds of the heart and what that tells us. And we can tell, are the valves closing right? Are they harder than they should be? Is the heart regurgitating some blood, which means the heart structure is not quite the right shape, which is allowing those valves to not close perfectly. Those types of things really on there give us an indication of what's the heart health in terms of prevention and overall health. That also gives us indications of what nutrients the body could be missing. And then we can apply that to our diet as well as through supplementation. Now, when we get into supplementation, we use some herbs, we use some food-based supplements. Big ones we use are standard process, Cataplex B Core. That's really big for the electrical signals of the heart. That really can support that electrical signal when we're seeing things like AFib or a heart block, that type of thing. It helps give that B4 vitamin that helps support that transmission of electrical signal from cell to cell in the heart. We also use PMG. It's an extract that supports the healing of the body and the autoimmune system against the heart. So that's called cardiotrophin PMG. We use a big herb called hawthorn. It's a berry that grows on kind of a bush. Great for increasing the blood flow to the heart. And then we shift gears into controlling our blood sugar and inflammation. So then we're going to look at a cod liver oil. So that is going to provide inflammation, omega-3s, which helps lower the inflammation in the body, because we're just getting too many omega-6s in our foods through crappy beef, chicken, corn, in everything. As a side note, make sure to get your beef, make sure it's grass-fed and finished. That really increases the omega-3s and lowers our inflammation in our body. We also use a couple of products to help with blood sugar in the body. Again, going back to how that affects the blood vessels and the inflammation. We use Diaplex, that's our main one for blood sugar. And then we also use red food, which has some beets in it, still has some chromium in it to help with the blood sugar, but it also supports collagen production, which can help heal those walls properly. But it also generates some nitrous oxide in the body production. So that helps dilate our blood vessels, increasing blood flow to our heart and brain, and even our muscles too. Those are some big ones. And then when we think there's some damage to our blood vessels, we'll use some Cyruta Plus, which is a lot of buckwheat and Swiss chard, that type of thing, to help give the clotting factors and healing up those blood vessel walls. All in all, exercise, get your sugar down, sleep, get your stress down, eat better foods that contain omega-3s and omega-6s, and you can really start taking care of that heart and live a nice, healthy life and not be one of those statistics in being one of the people who die of the most common thing, cardiovascular disease.